Okay, now we will doing the post-mortem care. Okay, first thing is I will identify all the vital functions like the pulse. Okay, there is no pulse anymore on her neck. Okay, now with the stethoscope, I will identify the heartbeat. Okay, the heartbeat is, there is no presence of heartbeat. Okay, now after all the vital functions are screened, I will notify the physician. After that, I will record the time and date of the pronouns of the dead patient. Okay, now I will notify the people or department. First thing is the attending physician. Next is nursing supervisor. Next is the KIN or KIN, emergency contact person. Then admitting census department, agency for organ procurement, and lastly is the medical examiner if available. Okay, now I will plan for religious cultural practice if the family decide to. Okay, after planning it, I will offer to transfer any other patients in this room for temporarily. Okay, now I will wash my hands to prevent the cross-contamination. Okay, after that, I will done gloving. I'll put some gloves to prevent the cross-contamination. Okay, after gloving, I have all my equipments near me. We have the cotton balls that's soaked in water and some dry cotton balls, a gauze pads or bandage, a emesis basin which is we can bath the patient. Okay. Then I will bring it near to the patient so I can grab all the necessary things during the entire procedure. Okay, now I will place the sign to the door or the outside of the patient, then screen the patient. Okay, after that, I will place the body in a supine position or to a flat position. Okay, now the patient is in a supine position. I will elevate the head by using 1 to 2 pillows. Since she has already a 1 pillow, I will put again a 1 pillow. Okay, after that, I will gently close the eyes by using for pressure for 2 seconds. For a few seconds rather. Okay, since the eyes is still moving up, I will place a cotton that's soaked in water. That's soaked in water. Okay. Okay, now I will remove all the jewelries. Checking if the patient had the jewelries. Okay. Then, I will make a list of all possessions here. Then, I will give it to the relatives. If there's no relatives, I will give this on the of my head nurse. Okay, after that, I will clean the face with a damp cloth. I'm making sure that no indentions will be made throughout the procedure. Okay, after cleaning the face, I will replace the patient's denture if the patient has a denture. Okay, now, after that, I will place a small towel under her chin. Okay. Then, make a 4-inch bandage tying on her head. Making sure that this will be prevent to open the mouth or open the jaw. Okay, after that, now I will remove all the IV fluids or tubes. Okay. Unless the autopsy department will take the place. Okay. Now, I will remove the dressing of the patient. Put on the hamper. Then, all the ostomy bags, then replace it. Okay, after removing all the dressing and ostomy bags, okay, now I will remove any adhesive mark with a gasoline. Okay, after removing all the adhesive marks, okay, now I will bath the body with a 2% Lysol solution. Okay, now I will bath the patient with a 2% Lysol solution. Okay, after bathing the patient, okay, I will check the vagina of the patient or the rectum if there's any presence of discharge. And if there's a presence of discharge, I will put a cotton ball on it. Okay, there's no presence of discharge at all. Okay, now I will remove my gloves by grasping at the center, then under. Okay, now I will put a clean gown on a patient. Okay, after putting a clean gown on the patient, I will cross the arms or position it by the gauze or bandage. on her chest. Then secure it with a gauze or bandage. Making sure it's not too tight or not too loose. Okay. Now I will put a ID band on the patient for the identification purposes. Okay. And now, if the patient is for viewing, I will replace the top linens. Then remove the old one. Then this will go to hamper because it's already soiled. Okay, now I will tie-dye the unit, all the units. Okay, now I will place the mortgage sheet under the dead patient or the deceased patient. Then I will wrap her. With the sheet, then making sure that the face can easily expose. Pretending that is already wrap her. Okay, and now the faces can easily expose like this. Okay, now I will transport the body to morgue and await for the arrival of the mortician. Okay, now I will put away all of my equipments that I've been used, then dispose it. Okay, now I will wash my hands to prevent the cross-contamination. Okay, now for evaluation, I will evaluate all the body cared, from the body cared, then making sure that the transportation or the transport of the patient is made appropriately, and making sure that all necessary notifications are carried out. And also, I also carry out the family rituals. Okay. And now for the viewing, spending viewing time of the patient must be seen if the family of the patient is hard to. Okay. And now, all the possessions are handled appropriately. Okay. And lastly, I will document all like the post-mortem activity, the time of cessation of the vital signs, then all the persons notified, the time and notifications. Okay, then I will list all the disposition of valuables and positional effect. Okay, and the time body removed from the unit, then her destination and other information required by the facility or department. Okay, thank you.